and you all are aware of that. That is, there is a neurologist most of the time, or a pediatrician, or a psychiatrist, or a psychologist, and there are some medical supportive teams for that thing. There is an audiologist, a speech pathologist. Most of you will be aware of their services. A clinical psychologist, and physical medicine and neuro rehabilitation group of people are there. Then other allied specialties people are there. But can we, Nishchinda, I think that they are planning, and ICONS was planning or developed in the fashion like that with a multidisciplinary team approach to the training and treatment of these children with autism spectrum disorder. Our aim was something like that, to reverse the children. If the children are coming quite early, can we reverse them and make them back to normal life? That was our idea. Now, the second approach to is that how we are going to live with them. But living within them, they are part and parcel of the society. And how can we use their skills in the social development? Because once somebody, because we know that our society is quite different. All of you are, especially Dr. Narayana sir, is very much aware of the social settings and what in a social setting, because we have got different type of people and we are all living with them. So children with autism spectrum disorder or differential ability or differently abled children are also part and parcel of the society. So how can we use their services to the overall development of the society, and how can we live with them? Now, for this, I sometimes quote several examples. See, classically, we all speak that a child with ASD cannot communicate or socially interact. Now, we look at the so-called neurotypical individuals. When we are engaged with some activity, we may not be communicating at all. We may be traveling in a bus or a train without talking to the nearby passenger for several hours. That doesn't make us that we are said that is a handicap for any of us. And so if we engage them in activity, this is a thought, or that is, suppose their peers are trained in such a way that accept a person who is not able to speak or interact to you in an expected manner or the social norms, in the accepted manner of the social norms, then why don't we include them in another way, or we remove the barriers in a different way, so that they will also be part and parcel of the typical society, and so that we can use their services in a different way or their abilities in a different way. This is what is the basis of the alternative approach. So I'm not saying that all these specialists are required for a teamwork, or many times we have said several models of these things are developed all over the world, including the most advanced areas, but we could not come to a model that is useful for all the people or across the world and across different cultures. We could not develop a suitable model. I'll come to the theoretical consideration that has come recently in this respect, and while I am going on with the discussions. Now, this is the mode of a institute that we developed at Shornur as well as Trivandrum in the name of ICONS Institute for Communicative and Cognitive Neuroscience. I think that now the Nishchinda also is developing in this thing. Then we need to have certain strategies. We should look into certain programs by which we can think that because as I am speaking ASD, when I am speaking as a symptomatology based condition or a developmental disorder or a developmental problem, then we need that there is an individual variation across children in their abilities as well as disabilities and problems. So I am talking from the point of view of a biological model. And of course, there is a social model. Now people are combining these two, that is the biological model plus the social model. And if we combine these two things appropriately, there are lines in which we could make such a program that it is suitable for everybody. Because individuals vary in their abilities, whether they are neurotypically developed or atypically developed, they vary in their abilities. as well as their entry point into this type of a mode of rehabilitation program may be different at the age at entry. And second thing is that the severity may also be different. That is, there may be mild cases, there may be moderate cases, there may be severe cases. In all those things, we need to have a program, what way we can fit them into it. Because Nishinta's training program, I have looked into it, it can be made suitable for or make a suitable program for those who are mild level, those who are at a severe level, or at the age, or at the levels of gender. Based on the gender, we can have a different type of role. I will also suggest, as a neurologist or working in cognitive, I will also suggest we have to take this just like many other medical conditions, because now genetic is coming to intervention level. Then neurochemistry and biochemical studies are also coming to intervention level. So we may use it at some time, so that we find that it is not only simply that we talk about the rehabilitation from a social model alone, but also from a biological model. So that is how I have prepared this program. And whether it is adaptable, whether it's adaptable to every center, I do not know. Maybe that by experience we will come to these things at a later time. Now, what should be the objective of a program of a skill development? And I will put it in both terms like this: to develop life skills required for an independent living in children, adolescent, adults with autism and intellectual impairment and physical disability. Why I put this in this way is that independent living. In one of the epidemiological studies that is published from Britain, Great Britain, it was mentioned that they did a survey in the household where many intellectually challenged and autistic persons are kept at home without involved in any social activities. They are actually bound to home, so that even they could not develop a epidemiological data on what is the real prevalence of this disorder. So that's why I said that I thought the presenting like that, because an independent living for them, how can you develop a program to have an independent living for them? Then to develop that skills that is required for the ADL, activities of daily living. ADL means activities of daily living. Because we are in a cultured society, we all feel that we have to do certain activities that is required for us to be in the normal, without the help of other people. We can engage in many certain activities which keep us individually disciplined or individually clean or individually prepared for our day-to-day activities. Second thing is that, third thing is that to develop skills required to avoid hazards. And there are many hazards. I put certain points like hazard related to fire, water, or travel, or other natural hazards. From this type of situation, how can they take or secure safety? For example, now we are facing with several natural hazards, several diseases, infectious diseases. How a differentially abled child will protect themselves from these things unless somebody is not there to help them, unless there is somebody to help them? How can they themselves find a solution to that? And of course, nowadays also there are in my clinic many children with ASD coming. They wear a mask. I ask them why you are wearing a mask. They will say that COVID is there, that is why I am wearing a mask. So those who can speak like that. Others will say that mother, they will point to the mother, he is or she is. But they are all adapting that. Whether they have developed that knowledge from some other sources, that is some problem is going on, so we all have to wear a mask. Is that knowledge imbibed in them in some other way? I'm not very sure, but still they are adapting to that thing. But will such type of skills will be there whenever there is a hazardous thing is there, to avoid themselves, protect themselves. So these tips we have to include in our training. Apart from most of the training centers, I know that they are concentrating on a language development or a writing skill or a reading skill or some activities that is relating to the attention, social interaction, etc. But to avoid this risk involved in routine life, how to avoid it, how to protect themselves. That is it. But at the same time, look at, we all have seen these persons with a disability, especially children with autism, and no, I have not seen them injuring themselves from the routine hazardous things like accidentally burning their hand. It's very rare. Or injury from a fall is occasionally that is there, just like that in the normal population, but I don't find an exceptionally high incidences of this type of hazard. So they know that there is some way of natural protection. They have got, but what is that way? That I do not know. Now, the most important thing will be the fourth point: how to develop skills required to gain a job opportunity, to get a job, and what way we can employ them. Then develop skills related to control of frustration. This is something which every person, every parent sometimes complain, put it as a complaint to me. That is, there may be temper tantrums, self-injurious behavior, inflicting injuries to others, or destructive behaviors. And what is the basis of such behavior that is coming, and how can we control that thing, and what skills is required to control those things. So of course, there are many theoretical possibilities that put forward in it. Many times people depend on various types of medicines. And once I reviewed what are the medicines that is used in ASD, it is just mentioned like this as a single line, that is all the drugs that is developed in psychiatry for treating psychiatric diseases being tried in children with ASD, including giving electrical shock, but without much effect. That is the way it has put as the second line. So means that we are now depending on medicines of different natures. You are all aware of that thing. But other than that, is there any other method by which we can control, we can understand the reason for their frustration, why they are getting frustrated, what is the reason behind their emotional disturbances, and how can we control that? Now, this is a chart which we once this is there was a workshop in Toronto, and that time we were looking into this program, what all things we can develop and how we can plan it. One of this icon shown, or we admitted persons with a disability, especially those with autism spectrum disability, to develop training for activities of daily living. This is mainly for the adolescent group who are not trained. That is why we have that inpatient service first time. This thought process we put into a program. Of course, Dr. Narayanan is our governing body member, and he also he has been there with the institution for several meetings, and it was more or less successful. That is, when we do some routine program in a biological clock, like the ADL could be developed, and many people will at least come to a partial independent level on their activities of daily living. Then can we give training for them for cooking and serving? And this was also the second part of the project. I could not accomplish that before I have to leave. And third is taking care of washing their clothes, training for housekeeping, and training for safety, that is from water safety, training for safety of fire, then traveling in public transport systems, then training for road crossing, managing public spaces. Then these are things, up to these things I think is person related. And second thing is that job training or job oriented training. And see, we have seen bits and pieces of training models and experiences of people when they trained pets, or when they trained autistic persons to train pets or keep pets, and it was helpful to them. And many times they were very actively following such programs. Then something which is always discussed is the training for agriculture and horticulture programs, and training for arts, craft, and music. Of course, this is very widely discussed subject. And training for physical fitness, sports, and games. then control of abnormal behavior and behavior outbursts, emotional regulation, and age-appropriate education program. This many areas are there, and I'm just highlighting these things so that people should start thinking about whether we can work appropriate models on this and appropriate models, and what is our success in that thing, and what is its application to other society. These are the things which we need to discuss in future classes. Now, I'm taking few of them as a model and how it can be extended to beyond that that area. Main thing is that, for example, agriculture alternatives, can we take it as a model? Technology training, especially computer-based training, can it be taken? Tool familiarization and use of tools. Then another thing which I was thinking was very useful will be classifying, because this is something that biologically happens in all of us, and that is how cognitive development even taking place. We classify or group. This is a reversal of what you call existing cognitive theories. That is, we are going back to old theories where there is our mind is automatically doing something like a automatic grouping and classifying of things. That is the basis of our cognition or basis of our knowledge. Then grouping and arranging and use of labels. Labels we use for everything and everywhere, and both graphically, pictorially, or both ways. Then pets is always part of our life, and how it can be used as a hobby as well as a source of income. Sports and sports, especially to reduce the temper tantrums and emotional outbursts, can we use it? These are the things which is coming, because you know that some of the sports has been used to reduce these things. I'll be just giving a little bit briefing on these items. For example, how can we take an agriculture or horticulture as a model? So this we can start from simple basic knowledge of cultivation in miniature situations, such as a grow bag, which is now advertised widely by the agriculture department, or a kitchen garden. From that we can go up to a food processing or skill development as a part of participant, as this differentially abled person are also a participant in that, so that even it can be developed in a multifaceted industrial processing, like food processing from seasonal fruits, agriculture crops, etc. So we just imagine that, for example, if you think Kerala coconut that is plenty available, how can we use it in a different ways? Starting from collecting is that thing, or using it husk in some way, so that it can be in core business. We know that how much it was processed, or you think about how it is used for food processing, and how it is used for making oil, how it is used for, and in each of these levels, there are high-tech things that is involved, as well as very low-tech things that are involved, or simple processing that is involved. Now, if you combine all those things, and then it is possible for us, that is, such a simple things can be advanced to a higher level. It's not that because in every training program, when we are saying that why we need a job is mainly it's not only for mainly for income generation. It is, of course, it is for income generation, but it is also for a type of involvement of the individual. So if we can combine these type of things and think about a suitable way of doing that thing, then it can be developed as a high model, or a model which can be evaluated further, whether it can be extended to the society in a large way. Then horticulture, for example, it is not basically simple gardening we are looking into. It's gardening, basic knowledge of gardening is there. But floral arrangement is something which can be used as a training for persons with a disability. Then, for example, think about medicinal culture of medicinal plants. Then it can be even taken to a level of the industrial. So such models have to be elaborated and made useful in such a way that it is applicable to persons with a disability at certain level, as well as at the higher level, the people who are involved with them. And that way, that may be a better model for the society even. It can be a better model for society even. Now, at this second model I was thinking is that why not we use certain sports and games, because I know that children with ASD like certain, they themselves are involved with certain sports. They like certain sports. For example, they all have got a unusual skill in balancing. This we have learned in some children. They do bicycling very well sometimes, and they like bicycling. And horse riding has been used as a training model at Bangalore, and they found that that can be used as a training program. Swimming is another exercise that has been used mainly because most children with ASD like water sports, and they like to be in the play with in the water. And walking or yoga, like that, we need to develop certain identify certain areas, and this we developed it as a model. And once we develop it as a model, we study, take a group of people, study for some time, assess its effectiveness, and then okay, project it as a useful model. And here some theoretical thing based on the from the neurological. For example, exercise brings fatigue in people. When exercise is there, fatigue is there, it calms down. So it will be better than a medicine that is used as a sedative, that is going for a good exercise program. See, for example, now neurokinesiology is a developing field. Neurokinesiology simply means an exercise program. That exercise program is used to reduce or ameliorate many disorders, including lifestyle disease like diabetes, hypertension, ischemic heart disease. I'm also feeling that this can be used for reducing the behavior problem in children with the ASD or other disabilities. Of course, it will be useful in many other ways because their locomotive ability, their intellectual abilities, they all improve. So that we should select appropriate program which is useful for our situation, which can be applicable to several children, and that way. And then we should also study it, and we should what is the effect of such program? How do you evaluate it in appropriate in an appropriate research model? Now, a risk analysis is important in all these studies. What type of risks are involved in any of these training programs? What type of social resistance we will face with that thing? And what is the time and economic factors involved in this type of training program? And what is the parental acceptance in this thing? Now, this is something that has recently come. So I'm going to stop. I just only one or two slides more. This is a model that is developed recently, that is developmentally appropriate practice, that is called DAP in short form, as a guideline for educating children. This is based on that children are better understood in their own social context, culture, and society. I'll also say that their abilities or their own inborn ability or inbuilt abilities. So teaching everything for everyone is the thing that has been followed us. But it may be that we may change. It may change it appropriate for the individual. There may be so much of resistance or lack of coherence when we are telling that everything to be taught to everybody, because that may not be acceptable for that particular society. So differently abled individuals as well as autistics or learning disabled children, they may have a set of program which is more suitable for them, appropriate for them. It is our duty to find out what is appropriate, in which they are more skilled, or in which way we can train them, and then impart the training program. And so that is why I borrowed this educational program and use it as a base for it. Second thing is called the theory of mind. Now, theory of mind is something which we use in modifying our behavior or our living in everyday life. That is, daily social life depends on the ability to evaluate the behavior of other persons. So, if we have a child or an adult or elderly or an elderly person with other type of disabilities, it is our duty to assess that is what is their mental state, and that ability we need to have. It is we assume that because all our social, cultural, and behavior is based on this theory of mind. That is now people are thinking like that. But by the age of 4 years, children normally pass a task that tap mental state understanding. They understand other people's intention. They start understanding this. So this is taken as a hallmark because there is a test what is called false belief task. The false belief task, we believe certain thing in a false way, we correct them. So that type of a approach we have got for things. And this theory of mind is not well developed. That is one of the feeling that we have got, or they have got a different theory of mind. It's either of these things. Because it is not that children with ASD understand people in see other people suffering sometimes. Sometimes at an impulsive moment they may injure somebody, but at the next moment they themselves become aware of that thing, and they may go and pacify them. So that is there because, so I will say that it is not that the theory of mind is not fully it is not developed, but it is that it's developed in a different way, and we have to try to understand what is their theory of behavior, or what is their theory of mind, why they are getting frustrated, or why they are not able to plan futuristically, because planning futuristically is sometimes difficult in them. And so let us go that. So these are the theoretical approach that on which we can evolve or develop a training program. That is one based on the theory of mind. The other is a false belief task, and second is a shared attention mechanism. And this can be achieved through not only by specialists involved in it, but a good peer group. And the peer group can be other than peer group can be anybody. It need not only be a teacher or trainer, but their own friends, our own family members can be a peer group. And we need to have an analytical behavior approach to them. Suppose somebody is showing a temper tantrum, we first analyze why, for what purpose. A person who is not able to communicate properly their feelings may show an abnormal behavior based on some other factors, maybe an external factors, an internally generated factor, or something else. Then we have to have a working in proximity, or close to close, or hand to hand. Then there may be a trial of a forced sharing. Then an applied behavioral analysis can be used for training them. Then a cooperative approach can be there. A cooperative play can be there. You can also arrange parallel games or parallel plays. So these are some of the theoretical applications that we can use, or basis that we can use when developing models. And it may be our responsibility, or it may be our trial that we you make these models and then apply it to a group of children, and then rate the success and analyze it properly, find out where we are failing, and then go to a and develop a proper model for training. So this much I'm giving it as a point of discussions. May each of you look into these things and put your input into this thing and have discussions, and then we can plan ahead. Thank you. Would you all hear this?
Yes, doctor. Yes, we could hear. And yeah, thank you, Dr. Suresh, for a very detailed presentation and many suggestions for us to practice at Nischinta. And it was very focused and setting directions for our training program that we intend to, start at Nischinta. I think now we can now, I think now the floor is open for questions that we can ask. You can, those who want to ask questions can unmute yourself and then ask. Others, please keep it muted so that we can hear clearly. Yeah, I have one question I will start with. I think in the beginning you mentioned that you did some study started on reversing the autism.
Yeah. Yes.
So what is the any findings of that study and any?
Yeah. This these studies which was on drug modeling, which I was talking,
Yeah.
and then of course they, for the adults they have, or adolescents they have got a peer training program. Peer training program is something they found that it is useful. Suppose the peers means our classmates themselves identify in the general setup, they themselves identify the problem of a person who cannot communicate. Then, if they start understanding it, their behavior, their tantrums come down. If you imagine about a situation, if suppose somebody wants to tell something to you,
Yeah.
and that particular person cannot express it. We ourselves might have experienced it several occasions where we are frustrated when we are lacking the appropriate words. And if you are not getting the appropriate words, we will change to gestures. And sometimes, see for example, intense feeling of an emotion, how people are expressing it. You can imagine whether suppose somebody is winning a Wimbledon match, they cry instead of being what you call very happy, expressing happiness in another way. So they do a paradoxical emotional expression. So a child with ASD or children like that, they may not be knowing the entire meaning of the social or environmental changes that is taking place around them. So they get frustrated. For example, I have a child who was frustrating on that when he is waking up in the early morning, if he saw the sunrise near the window, he gets upset. And he will go on crying or jumping because of that thing. And parents were not understanding it. And they naturally go to a doctor and put on medicine. So simply making them waking up early so that the sunshine is not there, that improves them. This is what you call we understand their problem. That is peer training. So the peer training is something like that, understanding the problem. Second thing is that sharing behavior, that is also a peer training program. We do things together. When we are doing things together, there is called a shared mental approach. That shared mental approach can be with because a neurotypical individual, it may be knowingly, or sometimes we are doing it unknowingly. If I pass an object to another person, or he receives it, or if I receive another person's object, that is sharing a thought program or sharing some goals. That sharing of goals, and ultimately find that it is good, then they will also start doing that thing unknowingly. And this type of one study was there in abroad. I forgot the name of university which they did it. They did it in universities with the university students, and this peer group training program did. And the result they said that it is better compared to other without much medication. Second thing is that is coming about to the biological model, where early identifying the disorder, of course, there is no biomarkers to say that is this person is going to be autistic or this person is coming. Of course, we have got for other disabilities, for example, Down syndrome, we have got a biomarker like a chromosomal anomaly that can be detected, or hypothyroidism, we had a biomarker like a thyroid function test that is. But in ASD, up to this time, we are depending on the behavioral pattern. Based on the behavioral pattern, we are developing the diagnosis. And of course, within that, there is a lot of heterogeneity. We are identifying different type of problems, especially in countries where they are doing advanced research. They are finding that the neural network connections are not proper. So there we are coming to the level that there are neurotransmitters into the individual pathways, and so there can be medications which will help, and some of them are useful and reversing it, especially autism with epilepsy. And in this step, when the anti-epileptic treatment is given properly and autism symptoms are reversed, metabolic disorders like phenylketonuria, when the phenylketonuria is treated appropriate with appropriate drug, there is a reversal. Neuroleptic drugs, that is called some of the drugs which can be used for neuronal enhancement, that is called or the brain tonic like acting drugs, that is coming, and there are some effects being reported by them. Some biochemical changes are basically seen in many children with ASD, and when we are addressing that thing, there are improvement there. Dietary modification, when we are doing, there is an improvement there. So these are some of the signs which help us in the medical management. Other than that, of course, this adult training program is in primitive stage, and they are reporting that there are some successes there.
Thank you, Dr. S. Any more questions, please?
Sir, good evening, sir.
Good evening.
Sir, I am Joy, father of GD Joy. Sir, what is your opinion about? Sir, what is your opinion about stem cell therapy?
Okay, good. Of course, this is a very controversial area. Right now, I am not ready. I myself is not very much convinced about the theory of stem cell therapy. The reason being, stem cell. What is meant by stem cell is that that is the omnipotent cell. Omnipotent cell means that the cell that can develop into different lineages of tissues, because we all come from a single cell dividing into different patterns, and then organ specific cells. When it is going to organ specific cells, the organogenesis takes place, that is different organs develop. So once a person is fully developed, that is a child is born, by that time the organogenesis is complete. So it means that the stem cell has lost its early potential, and now it has gone into differentiation. That means that organ specific differentiation. Into such an individual, suppose we introduce a pluripotential stem cell, where it has to go and lodge, or how it will identify the damaged area. That is the question to be addressed, and that is not yet proved. But if we go to the next generation, what we call the progenitor cells. Progenitor cells are cells that is derived from the stem cell, but that is organ specific. But for example, if there is a brain specific cells are there, that is brain neuron progenitor cells, or that for the neuronal population. But we have to understand that that is for the entire neurons. Neurons are different, subserving different type of functions. It is not on one function alone. It may be an astrocyte, means that a connective cells. It may be a motor cells, that is controlling motor activity. It may be programmed for a sensory appreciation. It may be programmed for language, but we do not know that is how this cell is going to develop within a normal, within an individual that is fully developed. Individual here means a child, even a child, how it differentiates. The theory of stem cell came only because stem cell therapy was successful in bone marrow transplant in persons with leukemia. And that is a successful thing, and it is being used now also. So from there only this theory developed. But as far as we know, we do not know whether this stem cell go to the brain, and that is after differentiating to that level. It is not differentiated to that. Stem cell means it is still pluripotential. That's why I am really concerned about that theoretical approach, but people are trying it, and I have come across with a few children who have received stem cell therapy, but without much change when the person was brought to me.
Yeah, can I raise a question pertaining to the stem cell therapy?
Yeah.
We had taken our son to Bombay. So in one of the doctors in Bombay very exclusively claimed to have done an extensive benefit for the children with autism using the stem cell therapy. So since we had received very varied responses from many parents with respect to the stem cell therapy, so you know, having said that, if we have an approach towards the stem cell therapy, I mean, what implications it could have with the presumption that we may get some benefit or we may get no benefit. So will it have an adverse effect on the child or otherwise?
There can be, because that is there are some complications that is described with all type of stem cell therapy. What is called growing of abnormal accumulation of cells within certain secluded areas, or developing seizures, epilepsy because of this. See, for example, the theory there are two theories behind the stem cell replication. One is that first, already the cell is fully what you call multiplied into organogenesis. Is from a single cell we all evolved. So its stages are timed. For example, first division is called symmetrical division. Up to 4 cells, it is a symmetrical division. After 4 cells, it is asymmetrical division. When it started asymmetrical division, organogenesis started happening. So when you are giving a stem cell, is it the precursor stem cell for a particular lineage of cell that you are giving, or you are giving the original omnipotent stem cell? If you are giving the original omnipotent stem cell, then how it reaches the targeted region? That is the particular question. We also have a seminar that we arranged in ICONS regarding the person was regarding talking about the benefits of the stem cell therapy. But when I asked specifically this question, he also was not able to. Well, these are Bombay-based group. They could not answer these questions in a way. They do not know how it is exactly happening, but they think that it is doing benefit, and they showed some functional MRI based on which the functions are improved. But there also we have got certain difficulties to answer whether how and why how these cells reach the targeted region. That is the main question. And that they were not answering. That is why I was not promoting that program. Initially, I thought of our institution be a part of this type of programs, because a lot of differentially able children are coming there. So especially the quadriplegic children, global developmental children, and autism children, all were coming at that time. So well, there is no single medicine which can help them. In that case, why not we do like that? We were planning and thinking, but this is the difficulty. We cannot get answer. But we have a theoretical possibility that we worked out and we discussed with the government of Kerala, but we could not establish the lab. The idea was, for example, if you cover the progenitor cells means a stem cell dividing it into the target organs. At that stage, it pick up, and then we infuse it or locally inject it, there may be a possibility of incorporating into this thing. And that is where then the hazard is that it can produce teratogenic effect. Teratogenic means that they may form teratomas. These cells which we are giving into the individual, they may grow as a separate organism within the individual. This is happening because teratomas are something which we know that tumors that are arising from this embryonic cell collections, which is get lost during development. This is one of the. Did you understand that? So this is the most important complication that is described with the stem cell therapy.
Is the stem cell therapy a legal process in India?
Oh, I'm not. Stem cell research is legalized, and guidelines are being crafted, and that is, I think, it is biotechnology department, DBT, Department of Biotechnology. So they are promoting stem cell research, but stem cell as a therapy, I do not know whether they're legalized. I don't know.
Okay. Thank you. Thank you.
Yeah, thank you. Any more questions?
Good evening, sir. Venkat here.
Good evening.
Good evening.
Sir, I just want to ask you, as suggested by you, our skill development floor is ready. It is opened yesterday. And kindly suggest how we have to make use of the place and move forward starting from December.
Oh, from December, I put certain suggestions. That is, I would suggest number one is that evaluation of the person who are enrolled with you,
okay,
and then see what are the potential areas on which you can develop this particular child or adult or adolescent into the training program. Then second thing I would suggest is that identify certain models. As I told you. See, for example, suppose you are developing an agriculture model or a horticulture model or a game therapy model, work it in such a way that this can be extended in different levels. For example, simple gardening technique is a horticulture training program where the child knows that he has to, a grow bag should be there, he has to water the plant, you know that the flowers may come out of that thing, or the root has got different names, or how to label these things, etc., etc. But I would also suggest in such situations, suppose you think about instead of simple gardening, suppose you are thinking about that it is Ayurveda plant garden that you are going, or this medicinal plant garden you are doing. So that the potential is that can be developed into an industrial program.
Okay.
Similarly, suppose we discussed this thing in one of the seminars we arranged in Shornur. That is, let us imagine that because any program, the economic part is most important. What is the source of money for us to have sustainable programs? Suppose we think that we start collecting coconut from all over. And we have a program by which we collect these collected coconut, from which we are going to yield coconut oil and market it. That is an income generating for the organization. Very simple method. And I think Dr. Narayana sir is much versatile than me in this aspect. He knows that how this can be utilized on them. See, for example, I have got a high-tech thing also. For example, potassium chloride is something which is widely used in medical treatment. And this, you see that coconut water has got the highest concentration of potassium. And so think about that, think in such a line that we can use it as industry for developing it or research into it. Now, what is the role of your child inside that thing? Because we have got different sectors there and different plans are there. For example, in our MBA classes itself, they are saying that labeling, grouping, and arrangement is a task.
Correct.
It is a task that is required in every, you know that many of these shops where everything has to be labeled, everything has to be arranged. And we know that children are good in some ways, these things. So both way you can apply. That is, on one way, you are developing that program from grassroots level to an industry level program. But our children are incorporated at different levels as an employment or an employee's component will come automatically to them. A job will come automatically to them. That is my approach to developing these models.
Thank you so much. But apart from your guidance, any tool we can refer to, or any of the area where we can refer to as a way to approach and or way to move forward?
Tools means
any of the other tool available in net or any of the area where somebody is already practiced?
Yes, see, for example, yesterday before me preparing this presentation, I was looking into training program for adolescent in the net. You see that of the scholarly article came only one article which I thought some value was that the peer training program, which was done by some universities. And that peer training program, they have put certain theoretical approaches like that, which we also practically do. And so, as we all know now that our understanding about autism, that is the global understanding about autism spectrum disorder, is the present state is that we know something about the symptomatology of these children. We know how to clinically classify these children. We have got good epidemiological data about the prevalence of this disorder that is happening. We know also that this disorder may coexist with other conditions or other disorders for which there may be a treatment. And at the same time, everybody speak about the training program. So my concern from looking from a biological model is that now the recent MRI studies, especially when those countries where they are using functional MRI or advanced MRI technologies, they have come across that there is a definite networking problem in the case of the brain of children with autism. This networking problem, especially that with the involvement of the frontal lobe is mainly concerned with that our social life, cultural development, futuristic planning, etc., and our behavior, attitude, and all those things is there. And in this respect, they know that already it's a problem. And in the presence of such a thing, then how the therapies work on such brain? That is the basic question that that arises in research area. Now, the second aspect is that when you go to the basic level of brain, that is the neuronal level, there are only two activities. One is an electrical activity, an electrical field. Second is a biochemical aspect or a chemical aspect which controls these electrical activities or which is responsible for this electrical generation. And from the combinations, we come across or formatting that taking place, and that formatting is it. So in every disorder, there should be every disorder means that even normal or abnormal individuals. Normal individuals also, we get angry, we get temper tantrums, we get emotional disturbances, we may have physical disabilities, we have got skill problems, everything will be there. All of us may not be singers, all of us will not dance properly, all of us will have problem in acrobatics. But at the same time, we all have the potential to develop like that. When we do such things, these type of cellular connections are basis for that thing. So if a cellular processing is not taking place, there may be methods, there may be methods by which you can activate these things. So in your Nishtinda program also, you should always give a room for developing your own program for a research to find out these things. At least not today, but tomorrow you will be able to treat patients with and that is a responsibility of a particular country. It's not that everything we can anticipate to develop from well-developed countries, because they are also groping in the dark.
Right.
Okay.
Thank you so much.
Thank you, sir.
Thank you.
No one is asking. Yes, no one is asking. I'll ask one more question, sir.
Hello.
You have suggested us to create a open therapy center instead of the classroom. You have already visited. You have seen the right side of the knuckles. There is a place available wherein you have suggested us to create the open therapy centers. That need to be covered, or is there any specification and thing will be there, or is a small with a bamboo and things like that, a small classroom to be created?
Yeah, I will.
Hello, sir.
Hello.
ആ തെറാപ്പി റൂം എന്ന് പറയുന്നത് സിമ്പിൾ ആയിട്ട് ഒരു ഹട്ട് പോലെ ഉണ്ടാക്കിയാൽ മതിയോ, അല്ല എന്തെങ്കിലും ഒരു കളർ കോഡിഫിക്കേഷനോ എന്തെങ്കിലും ഒരു ഡിഫറെന്റ് ആയി ചെയ്യുന്നത് കൊണ്ട് ഒരു വ്യത്യാസം കാണുമോ?
ഓപ്പൺ തെറാപ്പി സെന്ററിലെ
നമ്മുടെ പേരിന്റെ അവിടെ കൊണ്ടുവന്നിട്ടുണ്ട്.
ഹലോ ഹലോ ഹലോ.
Yeah, hello, please ask any question. Please ask.
Yeah, am I audible? Hello.
Yes, you are audible.
Yeah, sir, actually, I have a question. My daughter, 20-year-old, she is continuously spitting. Is it a behavioral issue, or I cannot understand what is the reason? What makes you to do that continuously? Hello.
Hello.
Yeah, sir.
Please.
Hello. So actually, my daughter, 20-year-old, she is autistic. She is spitting continuously.
Hello.
She does not do this.
Hello.
Yes, sir. Continuously she spits, but school teachers are saying that behavior is not there.
Yeah, that means it is a situation specific. Means that she is spitting only in certain situations. If it was, but I would, if a child is spitting around, I will always suggest with an EEG.
Sir?
With an EEG. If a child is spitting around,
okay.
Even if it is situation specific, because here school situation she is not doing, home situation only she is doing, means it can be simple attention seeking behavior. But if somebody is doing spontaneously that, it is always an indication to do an EEG and treat it.
Okay. Thank you, sir.
Because smearing the saliva around the mouth, spitting, even spitting on one's own hand, spitting on others, can be a feature of a CPS, complex partial seizure, behavior seizure.
No, not only house, even we take her outside also, she is doing that. So I find it very difficult to go with her outside. Okay, sir. Sir, any mouth giving pressure or any exercise like speech therapists used to do, that may help?
See, if it is related to a behavior, it may not help. If it is her inability to hold the saliva, it may help. That's it.
Okay, sir. Thank you.
She doesn't have schooling or anything.
She does not have. No, she does not have. No. She's epileptic attack. Yeah.
That's why I said that this is because this spitting around is or smearing the saliva is a feature of complex partial seizure. Usually arises from the temporal lobe.
Okay, sir. Thank you.
Any other questions?
Sir, such cases you are saying that EEG is advisable to take it at this stage again?
Yeah, it's 20 years also, because the studies on autism with epilepsy is that there are few studies which state that they may develop in the course of, that is 40% of children has got associated epilepsy in childhood or adolescence. Some of them may develop in the later ages. That is what they are telling many people who have followed our system.
Sir, do we get the correct result during the sleep EEG or the normal EEG? That's the forceful sedation or the normal?
Actually, the preferred EEG is both awake as well as sleep. But many children with autism, we may not be able to get a proper EEG in the awake stage. So what we usually do is that give certain sedatives which has no influence on the EEG. Because sedatives, because it calm down, it has got an effect on the brain, it may modify the EEG. So give medications in such a way that it will have least effect on the EEG. But you know that such a in persons who are grown up, they may give some powerful sedations, and such sedations have its own side effect also some days. So who always do it in a hospital, and those people who know how to sedate or choose appropriate drug for giving to these type of children, and they also aware that okay, these are the side effects that can happen, and keep the child for a day at the hospital, and then no problem. Usually no problem. But it should be told to the parents that this type of side effect may be there, because they should not get panic. Okay, medicine is given and this problem was there.
Thank you, sir. Rajiv sir, any questions which has come to you in writing? Rajiv sir.
No questions in writing came to me. No. 1 minute. Yeah, there was one question which says, can we request some sessions for training the trainers by taking specific area of skill, say 4 or 5 at a time?
Training on trainers, sir.
Yeah.
Training on trainers. Okay. We like this because we can arrange some program for trainers.
Okay, sir.
Yeah, it can include parents also, sir. When I say training the trainers, even parents can form part of trainers, because ultimately in Nepal they will all become trainers.
Exactly.
Not necessary that only a professional trainer has to be trained further. I mean, this is my point. Just 1 or 2 skills we can take specifically and concentrate on that for the parents right now, and subsequently for trainers. I mean, this is a request. I don't know whether it is appropriate to ask at this stage, or as doctor was telling that we may have to evaluate the children first, and based on that only maybe we have to concentrate on the training of the trainers. This is just a question which came to my mind, so I have put it.
Yeah, parents are the best trainers for the children.
Yeah,
isn't it? Yeah. See, the thing is, the way you understand your child, it would take some time for other trainers to understand. So the thing is, if you are being trained by a professional, then the approach you may adopt for your child would be the best option.
Yeah. All right, sir.
Yeah, thank you. Any more questions?
Sir, one more question, sir. Can I have one more question?
Yeah, sure.
Hello. Sir, actually, again, my child is taking this epileptic medicine, Diva ER 750 at night, Diva OD 750 at night, and 500 morning. Sir, is there any relation between her sometimes bedwetting and this tablet? Hello?
Suresh sir unmuted. Suresh sir need to unmute. Suresh sir need to unmute. Rajesh sir, you also need to unmute.
Yeah. Doctor, you have to unmute and speak.
Correct.
No, you have to unmute. Doctor, you have to unmute. Yes. No.
Unmute. Okay. Yeah. Can you hear now?
Yeah.
Yes, sir. Yes.
Oh, yes.
Thank you.
Okay. So I would because the name that is given is some trade name. So I have to look into what is the content, because many drugs can produce bedwetting. Bedwetting can be a part of many autistic children, because they may not have developed the bladder control. That may be the reason, or it can even appear as a behavior problem that happen in late adult age also.
Okay, sir. Thank you.
Yeah, thank you.
So, hope no more questions. Yeah, I think then we will conclude today's session. So
okay.
Thank you, Dr. Suresh, for such a wonderful session, and it's a lot of learning for us. And one thing that you have focused is gardening and horticulture, could be because a lot of open area. So I think tomorrow we are going to have a session at 11 o'clock on horticulture therapy, focused by one Dr. Bela from the associate professor in Kerala Agriculture University, and she has been working in horticulture for differently able children for last 15 plus years. So I think I'm just requesting everyone who has been here today to be present tomorrow at 11 o'clock. We have a session by. And thank you very much, Dr. Suresh, for the very enlightening presentation.